let's get started. So a few questions that were asked on that day was, explain a bit about endometriosis, and please give some tips about how to get through it every month.
Okay, endometriosis is a condition that affects women. It's when there is abnormal growth of the uterine lining in other parts of the body. So because of that, during your menstruation, you have almost like an exacerbation of symptoms. So you will have things like heavy bleeding, severe pain, sometimes blood in your urine or your stool, and the complications are severe, and it may lead to conditions such as infertility, which is the main concern when it comes to endometriosis, apart from the daily fight with PMS. You have a severity of PMS that you cannot bear. So one of the first tips I will give for anyone suffering from endometriosis will be to get diagnosed. First, you have to know that you have the condition before you can try to treat it. Now, one of the ways you can suspect that you have endometriosis is when you have pain that lasts through your entire period. So say you have your menses for about 3 days. Most times the pain will start before your menstruation and continue all through. And the pain will be very severe that you cannot go about your normal daily activities. Now, how do you cope with that? You can take over-the-counter medications such as ibuprofen and acetaminophen, which is paracetamol, to help alleviate the pain. You can use natural remedies such as using hot packs on your abdomen or your lower back, taking hot baths, eating fruits and vegetables that help alleviate discomfort and bloating. And you just have to know yourself. If you know the symptoms that occur during this time, you know how to kind of cope with them in your daily life, because it's a lifelong condition. Up until you have your menopause, it will keep giving you problems because it's associated with the hormones that are secreted during your menstruation. So I think that's the key point, that knowing your symptoms and try to reduce them so that you can do normal activities without bearing so much pain.
Okay, wow. Thank you for addressing that question. That I feel like that is very important, especially we as women. We might not know that we're going through a certain condition, or we should start taking things more seriously, especially things that have to do with our bodies.